we go. But the goals of this presentation were to sort of talk about what's in a name, what's the deal between equine chiropractic versus equine body work, and also touch a little bit on osteopathic medicine as well, since that seems to be getting a little more traction on Facebook and on some conversations that are occurring. So you guys know me, but I'm Dr. Meg Bacon, and so I'm a doctor of veterinary medicine. I do not have a doctor of chiropractic. I'll touch a little bit on the differences between those and why it's important to understand the difference. I have sort of a large educational background, which we were just talking about to get where I am today, but I moved to Boulder County this spring, and I work as a general practitioner in small animal medicine right now up in Nederland, Colorado, 2.5 days a week. But I also work as a mixed ambulatory chiropractic practitioner the rest of the time, doing horses and dogs and cats, and the occasional ruminant will be asked about, so a goat and whatnot on some of my travels. But to sort of get to be able to do what I'm doing, I did a bachelor's of science in equine science from CSU a long time ago, knowing that I loved horses. I wasn't sure about the rest of medicine in terms of other animals. And so I sort of focused on that for my early education, and then got sucked into the realm of horse breeding and training farms and really enjoyed that, but was highly encouraged to go into medicine. And I think that people that go into medicine should do it because they want to really do it and they love it, not because they can. And so I took some time and worked on those breeding and training farms. I did end up becoming a certified veterinary technician and worked in mixed animal medicine for a couple of years, and then went back for advanced education back to CSU, getting sidetracked with a master's degree prior to going to vet school. And after I became a veterinarian, I went through the process of getting additional certification in animal chiropractic, and I'll touch a little more on that in the presentation. So animal chiropractic, this will be the meat of a lot of this presentation, just because that's what requires a lot of education, and people have a lot of questions about it, and I also know quite a bit about it. But animal chiropractic, so what is it exactly? And that question happens a lot because humans get chiropractic done to them. So what's the deal with animal chiropractic? And so to talk a little bit about that, animal chiropractic is the treatment of vertebral subluxation units, which I'll get a little bit into what those are, but it's the use of a practitioner's hands on the animal to deliver a really controlled thrust into the body of the animal, into a joint, to an area that's diagnosed as not moving completely through normal range of motion. And so this controlled movement returns a joint back into normal biomechanical function. It's not the same thing as a subluxation in traditional medicine where a bone is out of place, but sometimes you'll hear practitioners say things about things being out. And by out, they really mean just not moving through full range of motion. And so that by allowing all the joints to move in full range of motion, you can have optimum health and mobility in our animals. And so for horses, which we ride and do lots of things with, that's really important. And so the vertebral subluxation complex, this is a really dense slide, but it definitely is the complete definition for vertebral subluxation unit. And so it's a joint space that's not properly moving through normal range of motion. And so when the practitioner, which might even be your chiropractor, says, well, you're stuck or you're out, it's the simplest way to sort of explain what's happening. But there's a restriction in movement. It can either be stuck in a neutral position, or depending on the joint, it can be stuck. If it normally moves left to right, maybe it's stuck more in the left position and it's having trouble moving to the right. And so when that happens, if you think about it, if I couldn't move my head to the left when it normally can, well, that's going to hurt. It's going to make my muscles cramp. It's probably going to make my nerves fire. It's going to create poor nutrient flow in terms of blood supply to that area. If it became chronic condition, it can actually change how the muscles are working. It can make you feel really bad, especially if it has to do with near your skull, because that's how we get headaches and migraines and that sort of thing. And so really when you get those type of subluxations, whether a human or an animal, you're going to have dysfunction, you're going to be in discomfort, and you might not move as you normally would. And so chiropractic treats those specific things. And so this image is really great. It's used by the International Veterinary Chiropractic Association, which is one of the associations that has to do with animal chiropractic medicine. And so on the left, you can sort of see normal vertebral units that are in the spine. So the bone is that sort of light pink color. And then the spinal cord runs through that. And then the discs are in between the spine, and then spinal nerves actually come out between those different vertebrae. Well, if the vertebrae are supposed to move left and right, and it's stuck to the left, like the picture shows on the right-hand side, there's a little pinching there. And so restricted mobility inside that joint space means that the flow of information, whether that's blood supply or nerve or any sort of communication, is disrupted. It's sort of like taking a hose and putting a little pressure, a tiny kink in it, not enough to stop the flow entirely, although that can happen, but to just make not flow as well. And so obviously that means that the organs, which include muscle or anything else, it might be an internal organ like kidneys or gastrointestinal system, it means that they're just not getting the message the same way that they would if the joints were moving appropriately. And so people ask about why chiropractic versus something else. I mean, what does it really treat? Well, if you think about nerves and the flow of information to your body, some people would say it can treat just about anything. So musculoskeletal problems are the most obvious: back pain, arthritis, but it might be things that you don't think about where, there's a behavioral quirk to my horse. He used to be fine riding, but now he throws his head regularly, and I've already had his mouth looked at by my veterinarian, and his teeth have been floated recently, but he really seems to be behind the bit all the time. Well, that might mean that there's dysfunction in the neck, and a chiropractic treatment can return normal function so that maybe that won't occur anymore. It can also help with neurologic disorders where that innervation is just not communicating quite right. Kissing spines is often associated with stumbling in the hind end. And so that's due to a pinching in the back. And yes, we need to treat the arthritis with traditional medicine, but we also want to keep as much of the spine mobile as possible and not allow the immobility to keep advancing through more sections of the spine. So treating with chiropractic is a great additional method. Similarly, things like navicular disease or laminitis have to do with a disruption in blood supply and nerve supply in the feet. And so by doing adjustments in the limbs, we can restore appropriate nerve supply to those areas.
I have a question.
Yeah.
So how hard is it to X-ray to see, if you have abnormalities in the spine?
So in a horse, it can be really challenging. It depends on the strength of the system used to radiograph. So when you have a horse that has suspect kissing spines, your veterinarian might decide to send you to the university because they have much larger systems to take those images that are more powerful. It also depends on how muscular your horse is. So it's really easy to take images of the neck, skull, neck, the withers region. It gets a little more challenging through some of the back, depending on the musculature of your horse. And then a lot of the lumbar spine, we can at least catch parts of it. But when there's a really thick hipped horse, that can be a little more challenging. And so sometimes we'll use ultrasound instead of x-rays, because the ultrasound can also show us inflammation in the joint spaces. We'll look for fluid in the joint and what's the quality of that fluid. We can also look at the thickness of the muscles because some of those lower muscles shrink and function. That's a great question. And so if you do, I do recommend, so when I go to evaluate a horse, since I am a veterinarian, I definitely work closely with the primary veterinarian, and sometimes there are horses where if they haven't had a recent workup and I'm suspecting a larger pathology process, so something like kissing spines, or it sounds similar to kissing spines and it's presenting like kissing spines, or any kind of advanced condition, I, as the person delivering chiropractic care and not primary veterinary medicine care, might say, I don't feel that it's appropriate to adjust your animal today, or it's not appropriate to adjust this particular area. I would recommend that we talk with your primary veterinarian to get some more information before we start pushing into the animal. And so people will ask about the DVM title, so Doctor of Veterinary Medicine, and what that really means. So we kind of talked about it. To be a veterinarian, you have to do undergraduate work. You then go to professional school, which is veterinary medical school. That's 4 years. And then some people even go further to become specialized in things like surgery, anesthesia. There is rehabilitation and sports medicine as a specialty. And so those people that become board certified have to do an internship, which might be 1 or 2 years working as a veterinarian. They've graduated, but they're trying to specialize and become essentially a master of a very particular type of medicine, just like humans do. And then they do a residency, which varies in that time frame to become that specialist. And then it behooves them to work within that specialty since they've taken the extra time to that education to do that. And as a DVM, as a veterinarian, you're technically not supposed to call yourself a chiropractor. You're supposed to say, I'm a veterinarian that is certified in animal chiropractic, because a chiropractor really does mean a doctor of chiropractic. You can go to both schools. You can say, well, I want to be both. And that means that you're going to go to chiropractic school, which is just as intense as being any other doctor, and you're going to go to veterinary school. And that way you could say that you were a veterinarian chiropractor. And so you have to be a little particular about, you're supposed to be a little particular about the wording, one, in a respectful form, but two, actually it can fall into some legal pathways if you're not careful in pickier states, for sure. It varies a little bit by state, how possessive they are of some of the words. But similarly, a veterinary technician is not technically supposed to be called a veterinary nurse, because a nurse, even though a veterinary technician does the same things as a nurse, the term nurse is owned by nurse practitioners in human medicine. And so if you have a DVM coming to do your chiropractic work, they're probably going to call themselves a veterinary adjuster or an equine adjuster, but they, colloquially, they might say chiropractor, but you have to be a little careful about that term. Versus a DC, so a doctor of chiropractic. And so they're a doctor in human medicine. They do the same undergraduate work that a veterinarian does, and they go to professional school that's specific to chiropractic in humans. And so they learn to be a doctor that is a master in craft at looking at biomechanical movement in humans in terms of muscles and skeleton and interpreting x-rays, and they can go on to specialize as well. Most frequently they combine with a master's either in diagnostic imaging, which is x-rays and ultrasound, or sometimes they do it in nutrition, since with any of these sports medicine type injuries, nutrition can often be a large component of joint health. And having a little bit extra weight can really hurt progress when it comes to joint health and arthritis management. And so they're legally not supposed to use the term veterinary in their title. They have not gone through a veterinary education. So that unless they decide to also be a DVM, they should not be calling themselves a veterinary chiropractor. Instead, they can say animal chiropractor, horse chiropractor, dog chiropractor. They can use chiropractor term as much as they'd like. They can also use the term adjuster. They just can't use the term veterinary.
Dr. Bacon?
Yeah.
Just going back a little bit, when you talked about doing chiropractic work on a horse, closely working with the veterinarian, would you ever request documentation from the person's vet first, stating that this is my diagnosis or my concern, and this is what I'm recommending?
Yeah. So every person's different that provides chiropractic care in terms of how they set up their appointments. So I can only really speak to how I do my appointments. And yes is the answer. That I can say, your animal, it sounds like from what you're telling me, because usually you have at least a brief history that there's some concern for this area in the spine. Before I do this, I would really like you to talk with your primary veterinarian about getting radiographs. or it sounds like your animal's really painful and we haven't tried any traditional pain management first, I would like to work with your veterinarian to maybe try a little pain management, because it's hard to do chiropractic on an animal that's in severe pain. You know, there is pain that chiropractic will manage that traditional pain management might not manage, but it's hard to just do an evaluation on an animal that's in massive pain. And so usually some form of medical management combined with the chiropractic would be recommended. And so for me, I ask my clients to fill out a Google form that's kind of like when you go to the doctor's office that says, you know, who's your veterinarian? Do they know that you're seeking chiropractic care? If they know that you're seeking it, are they wanting a record? Because you're legally supposed to take a medical record of what you do with the animal, and they might not be interested in it depending on the veterinarian, but the point is to ask. And then I ask for history questions. What behaviors is your animal showing? What surgeries have they had? Have they had imaging done? And when was it done? Have they seen a chiropractor before, and how did it go? How long ago was it? If I hear something that's a little questionable, I might say, I'm happy to try to initiate an exam. It sounds like we might not be able to go through a full exam. If you would like to talk with your veterinarian first, I think that's great. And I'll actually go so far as to, with their permission, reach out to the veterinarian before I see the animal as well. Does that answer your question?
Absolutely. Thank you
Okay,
so much. Yeah, I was just curious because I just was thinking about myself, and I'm a total wimp when it comes to anything chiropractor, because I'm like scared of the popping and the cracking and things like that. And then I'm like, well, you know, what if my horse is scared of that too, you know? So I was just like, should I start with massage first, or do I need like almost like a prescription from the veterinarian saying, yeah, you know, he's clear to get, you know, snap, crackle, popped or whatever.
Yeah. And so I will say, I think that probably just like leeways perfectly sort of into the next couple slides here, in terms of sort of the legality of chiropractic. So as a veterinarian in Colorado, I don't technically need permission from the veterinarian, since I am a veterinarian, to initiate treatment, as long as I'm doing an exam to make sure the animal is healthy, in my opinion, before I do the treatment. But since I really like working, since my goal is to work with the primary veterinarian, since I'm not doing very many primary services, at least not in large animal currently, I want to work with that veterinarian and I want their sort of blessing to move forward. As a doctor of chiropractic in Colorado, it used to be up until relatively recently that they actually had to get written consent from the primary veterinarian prior to starting treatment, saying that to the best of their knowledge, the animal is healthy and has no risk factors to receive chiropractic. That changed in the last couple of years, where the doctor of chiropractic is recommended to contact the primary veterinarian within 7 days of initiating treatment. And if they don't have a primary veterinarian, then they need to communicate to the owner what they're doing. And just like with any doctor's office, you know, assuming liability, if they find their DC, so this kind of goes into the which professional are you, all the DVM and a DC, everyone has to complete 210 hours of training with an accredited school for animal chiropractic. And so there are a couple programs in the US, and those have a standard of care. And then there's testing in terms of somebody saying, well, I'm certified in animal chiropractic. There's a difference between I'm a graduate from a program and I'm certified. If you are said that you are certified in animal chiropractic, you've gone through additional standardized testing, either through the American Veterinary Chiropractic Association or the International Veterinary Chiropractic Association, that has certain minimum requirements of ability that you have to show in both a in-person test where you position and work on animals in front of someone judging you, as well as a written exam. And there really isn't a lot of difference between the two tests, other than potentially how hard they are. The IVCA test is very technical in terms of anatomy. since it does come from based out of Europe. And like I said, they do a lot with physiology degrees and that kind of a thing. But also Colorado doesn't require you to be certified. Colorado only requires that you have graduated from an animal chiropractic program and passed. And so if you happen to go to a practitioner that doesn't say that they're certified, they should have the education and they should be able to say where they went to school, but it's okay if they're not. And if you go to a practitioner that says that you have to be, ABCA certified, well, that's not true either. You can be either, and it just means that you've met minimum standards of testing to be able to practice, and might hold to that. So I'm IVCA certified, mostly because with the pandemic, ABCA was not sure when they were going to be able to do testing again. And so it was sort of on pause. IVCA was nice enough to bring some of their instructors together and allow them to go to the school to do some of the testing so that we wouldn't have to travel all over the country to try and find a testing area, and know that we could get tested and certified if we needed to. And for some people, depending on the state that they're practicing in, they are required to get one or both of those. It just depends on which state they're in. As well as some states require doctors of chiropractic, they must practice within the presence of a veterinarian. It doesn't even matter if the veterinarian has chiropractic background, they just are not allowed to perform chiropractic without a veterinarian present. And we just are not one of those states.
Good.
And so when you choose a DC or a DVM, you need to do what's best for your animal. If you already have a great primary veterinarian, you know all of the medical things having to go with your horse, and your veterinarian saying, yes, I think that you should get a chiropractor to come look, and I would like to work with them. A doctor of chiropractic is a great person to work with. They are a master of feeling vertebral subluxation units, and that is their whole background, is to do that. I would also say, just ask what your primary veterinarian says. Do you think that I should get a veterinarian to work with my horse for chiropractic? Because I would say that some veterinarians are very particular about your horse and your case, saying that, yes, I'd like a veterinarian to do it because it acts like a second opinion, which is great. It's just another professional working with another professional. It just so happens that the veterinarian has a little specialization in chiropractic. But I would say that, beyond asking what your veterinarian says or recommends that you do, what horse experience does the professional have? Because ultimately, if I'm a practitioner that's going out to adjust a horse and somebody's asking me about when I'm riding, this happens, or behaviorally there's questions, or saddle fit or tack. They at Options for Animals, the chiropractic college that I went to, they talk about saddle fit and they talk a little bit about tack, but that's an hour in a 210-hour program. That's very different from somebody that's been riding a lot of their life and has shown horses or has bred horses, or if you want somebody that's worked in veterinary medicine and knows a lot about general medicine, then I would probably recommend using a veterinarian. It just depends on what you need, and it depends on what your horse needs. And so just making sure that you're addressing what your horse really needs if there are medical concerns, I think that's important. And then if you know that your veterinarian has recommended some extra modalities to support the chiropractic care, like laser, shockwave, or acupuncture is commonly done with chiropractic, then you want to look for a practitioner that can do both. And so a lot of times that's probably going to be a veterinarian, because they can go to school for animal acupuncture. Kinesiology taping can be in either profession. Shockwave is most commonly used with veterinarians because horses generally need sedation to get shockwave. And so that's not going to be with a DC unless a veterinarian's present or willing to sedate. And then laser therapy or electromagnetic therapy are both great arthritis support mechanisms that sometimes certain offices will have.
So Dr. Meg, do you do acupuncture as well?
I do not do acupuncture as well. I have been thinking about whether to add it into my repertoire. It's another large chunk of schooling, which also comes with a financial component. And right now, with the things that I'm doing, I'm very focused on rehabilitative sports medicine type complementary work, which means I am in the middle of getting certified for kinesiology taping because I already had some background in doing that. And working on exercise program development, since
Oh, that's
my background is a horse practitioner, sort of makes that in my wheelhouse.
Yeah, I love
But
that.
I do like working with people that do acupuncture, and I think that for an animal that needs quite a bit of pain management, I do recommend acupuncture, and I will gladly work with an acupuncturist or refer to someone that does it.
So the
What about-
kinesiology taping, is that being found to be successful with horses?
Sure is, yeah. So when you have a horse, so kissing spines is a great example, actually. When you have a horse that has any kind of metabolic condition, they often will recommend not using steroids as an injection because it can cause a laminitis episode. Instead, they'll recommend things like biologic therapy, so IRAP or PRP. And unfortunately, that can be really cost prohibitive for some folks. And it's injections. And so it's also, some people don't want to be that invasive. I am a believer in using injections when you can to lower pain, but kinesiology taping in a kissing spines horse can really remove some of that compression of the skin and the fascia, as it's a lot of times in a horse that has a little bit of a sway back. And so kinesiology taping combined with a rehabilitation program where you're trying to rebuild core strength is great at removing pain and discomfort. I also think that it's really good for neurologic cases. So wobblers, horses, they don't quite necessarily know where their legs are in space because their nervous system, the chain of command is a little kinked in terms of communicating. So if I can use tape to tell the horse to think about this leg a little bit more, can you bring your focus to this area because I'm stimulating it? I can help retrain some of those pathways, similar to what sometimes acupuncture can do, but kinesiology taping is just a little bit different. Downside is that it only lasts like 3 to 5 days on a short coat, but it can be a less invasive and less expensive way to provide some supportive care. Those are all great questions. And so we talked a little bit about this, that every chiropractor is different. So, you know, or people that provide chiropractic care in general, what happens at a typical chiropractic workup? I've seen some folks go into a barn, there aren't owners present, which is not a big deal because the owner's not necessarily interested in the chiropractic treatment. And they go in and they only work on the axial skeleton, meaning the back and the neck. And that has to go with comfort with the horse. It also has to do with the horse's behavior, but complete chiropractic, or at least the way that I was taught it, is head to toe, with safety obviously being important, but making sure to look at the entire animal. It's not just bones and joints, it's behaviors and movement. And so a person providing chiropractic care should ask a thorough history, should ask about who your primary veterinarian is, if they're not already your primary veterinarian. They should look at the gait of the animal because you are potentially adjusting nervous input that might change gait. Sometimes we're trying to solve a lameness. Sometimes we're trying to remove compensatory mechanisms for a lameness. So if we don't know where the lameness is and how severe it is, how can we know if we're making a difference on our follow-up visits? It's nice that owners try and tell us, but as the professional, that in my opinion is part of my job, is to say, well, this is what I'm seeing as your baseline at your initial evaluation. And this is, I'm making notes of that. And if something's wrong before your next workup, I can look back at that and say, well, it could be wrong because of this, or we're making improvement here. This seems to be more chronic, or this seems to be less chronic. And so your chiropractic workup should involve that. Where is their pain? Where is their swelling in a joint? Where is their lameness? What do the feet look like? You know, if there's a toed in foot somewhere, or a toed out foot, or you know, and any kind of change in the feet, should be able to work with the farrier and say, you know, I'm having to adjust this area and this seems like the foot's quite toed in or toed out. What do you think? Is there something we can do to help reduce that? Because I'm having to do a lot of adjustments in this leg, and I'm wondering if we can help it by changing the foot flight. And so being able to think about those things are really important. So whole body, in my opinion, head to toe. And it's hard because we definitely have some folks in the industry that will travel to a rodeo and say, well, I can make your horse run faster. And they throw a couple adjustments, 1 here, 2 there, that kind of a thing. And that horse may have needed those adjustments. Who's to say, right? And especially if somebody says, well, my horse is tight in the poll. Okay, well, I can adjust the poll, whether it needs it or not. You told me to adjust it, essentially, if that makes you happy. But that's not what you should be doing. You should be evaluating the whole horse and making sure that you're adjusting only what needs to be adjusted. And then making sure that animal gets appropriate rest, because those things get tight because they're protecting something. And so if you open that up, you might be opening up an animal to some hurt if you're not careful. So it's important to think about that with your animal. And so that's sort of the chiropractic session. I just want to see what questions you might have specific to chiropractic before I launch into the body worker part.
I had a modality question.
Sure.
At the gym I went in and there was this thing that you stepped on that vibrated underneath your feet.
Mm-hmm.
And at some of the horse shows, it seems that's become very popular.
Mm-hmm. Yeah, so a vibration plate. It's a really popular modality, mostly found with board certified folks that are in sports medicine rehabilitation. And it essentially is about changing proprioceptive input. And the best way for me to sort of explain that has to do with when you stub your toe or you smash your finger, what do?
Shake it.
Shake it. You shake it. You shake it or you rub it, right?
Yeah.
And the reason that you're doing that is you're trying to change what is a pain pathway to a different pathway. I'm trying to change the stimulation so that the pain pathway gets disrupted and I can change the nervous input. And so if you think about it, when you stand on a vibrate plate, you are wiggling everything. So if you've got pain pathways firing, it's like you doing this after you smash your finger. It's going to change how you're thinking about, it's going to change how your body is feeling. And so they did this little thing where, when you shake how you naturally like to hold your hands in terms of how you put your fingers together, it feels really weird, right? To put it one of those ways. You don't like it. You want to do it a natural way. Well, if you go like this for 5 or 10 seconds, and then you do it the other way, it really doesn't feel as weird as it did before, because you're changing that input to your nervous system. So yeah, vibrate plates, they work really well to change pain input, and they're really great things for some of our more chronic arthritis cases.
All right, thank you.
Mm-hmm. Any other questions? All right, so animal body workers. So what's body work? It really just has to do with using touch to change input. And so we kind of just talked about, you could put somebody on a shaking plate and it's going to change their input. And I might be changing input by doing Reiki, for example, where I'm trying to change the energy flow, or what I feel is the energy flow in an animal so that its energy is flowing in a different way. Or maybe I'm doing massage and I'm trying to get a knot out of an area that I feel that there is tension, so that I can change the way that lactic acid is being taken out of the muscles and the way that nervous system and blood supply is getting to those muscles. And so technically, performing animal chiropractic is body work, but I would say the general layman's terms for folks don't group it together. But if you use this definition, which just talks about changing input, a chiropractor is a body worker, but a body worker is not necessarily a chiropractor. And so body worker, even in the International Association for Animal Massage and acupressure, those kind of things, they consider body workers to be using touch, not at a chiropractic level. It's about massage, Reiki, craniosacral, and some of these other things. So here's sort of the list for that. And so, massage probably being one of the top ones that people talk about. In Colorado, Masterson methods also quite popular, and it's gaining popularity across the country. That has to do with myofascial release and acupressure in terms of releasing tension in the animal. I actually use a little bit of that part of Master Method as one of my initial scans for horses, because I need to connect with that animal in a non-threatening way. And I need to get a general sense of how they're going to react with me moving around them. And so I do a scan that follows what's called a meridian line down the entire animal, and horses can feel a fly on their skin. So I use the lightest touch to run down this sort of high energy line down the body. And horses that are more expressive, like this paint horse in this picture, when I get to a spot of tension on her, which is likely a spot that needs either adjustment or massage, or it might be a place of pain because there's tension there, she yawns and licks and chews, and I am not touching it more than how you touch the hair on your arm. And she just so expressive in terms of releasing tension. And so the first time I met her, I could tell every spot that she was probably going to need an adjustment, and it really did follow true. And so, body work should work with chiropractic. Light touch, especially in horses, is really important because they're such sensitive creatures. Craniosacral is a newer catching description of essentially using a light pressure and combination of light pressure and massage, especially on the cranial sacral region. So essentially on the skull, to relieve tension. If you think about it, when you get a massage, when you go to get your hair done, how good that feels. Well, it's using anatomy and understanding of anatomy and the structure of the head and the face, and how it also connects the initial portion of the neck to release tension. Acupuncture takes lots of additional schooling. It technically changes the flow of energy and might be considered body work, but I would say of these things that are listed here, you need to be a professional, a veterinary professional, or somebody with advanced degree. It could be a technician in animal physiology before you can be accepted into an acupuncture program. And it takes rigorous hours of work, including following a seasoned professional for a period of time. And then it has testing to go with that, because we are putting needles into an animal and changing how the tissue is reacting and how energy moves. And so that does take quite a bit of advanced education to do that, similar to chiropractic. Reiki is about working with energy, and then osteopathic medicine we'll touch on at the very end of everything. But like I said, it's all about levels of education. And so having a person that's going to work on your horse with massage, which I would say is a common question, is you should be able to ask them where they went to school. And so technically, to say that they're certified in massage, they have to have gone to an accredited school. And that means that they have a certain number of hours they have to have completed in testing they've had to complete to say that they're certified. There's a variety of schools across the country. We have one right here in Colorado. It's very popular. It's the Rocky Mountain School of Animal Acupressure and Massage. And, it is rigorous testing to be able to do that, because you need to know advanced anatomy, because you're changing input and you're potentially treating a condition. You're using your hands to release tension within the muscles, and 80% of joints are supported by muscle to relieve strain and potentially pain in an animal. And so they should work closely together with a chiropractor and a veterinarian, unless you're just like, well, I just want a relaxation massage. Just like there's a difference for us if we're going to go get a Swedish massage versus a sports massage. Having somebody do something just for relaxation purposes is a little different than having somebody try and treat something. So it's important to get the right professional for you. And so this just is sort of the verbiage talking about removing buildup of bad things, as well as realigning fibers to allow for optimum movement and healing. And so your equine massage therapist should be able to show if I'm the veterinarian, let's say, and somebody says, oh yeah, my horse is getting massage from a certified massage therapist. Well, I should be able to contact that massage therapist and be like, would you mind sending me your credentials? Because I might want to know who's working on the horse. They should be able to, if they're saying that they're certified, they should be able to show you documentation that says that. And so that kind of brings us to the last section, but what questions do you all have about those main other body worker groups?
What's the difference between massage therapy and then the master's approach?
Yeah, Masterson method. Masterson method's more about fascial release with really light touch. And so it talks about the different pressures that are used to allow horses to almost naturally release a lot of tension, instead of deep tissue massage where you're sort of trying to work it out of them. And so they talk about different levels of touch in Masterson method, everything from as light as touching the hair on your arm where you're barely touching to they talk about touching a little deeper as if to create a dimple in an over easy egg. If you were touching the egg, to I'm trying to defect an orange, to deeper pressure. And so it's a lot of patience, because I might only be touching one area of the horse. Let's say that I'm touching on the pole. Well, I'm going to start with the lightest touch possible and see if I get a release. And maybe it gets a little deeper, and it's as deep a touch as necessary to get the release, instead of thorough full fiber down massage. There are great Instagram to follow for Masterson method. They also do, I think their Facebook page is quite active. And so you can watch these videos of Masterson method folks going through that. And you can take Masterson method as a lay person. And I think it's a great way for an owner to connect with their horse and be able to interpret some of, it's so easy to give our horses a persona and say, well, I can tell he likes it. Well, I mean, how can you tell he likes it? And some people are really good at explaining. It's like, well, I can just tell. And well, it'd be great if you could elaborate on that. And I think Master Method does a really good job of describing what to look for. And so they talk about release of tension, everything from light release, which is just more closing of eyes. So if you think about when something feels good and you just kind of lean into it and you're like closing your eyes a little bit, and then maybe you let out a sigh. And then for a horse, they start chewing and licking, and then they might shake their head or they might stretch. And so that's from light to large release. And even when I go through that little meridian line, I'll have horses that maybe they only blink their eyes a little bit, but I have horses that full yawn and head shake when I get to certain spots. And so I think it's great to learn the difference between a little release and a lot of release, and have the patience to feel that from a horse. And they do some in-person clinics around the country. So I think it's a nice modality for owners. You can also do kinesiology taping as a owner, but there's a difference between a kinesiology course for an owner versus a professional's course. And cost is different, and certification and that sort of thing. What other questions do you have?
I guess I was going to ask you a question. I'm a little embarrassed, but because it's not really a fair question, but do you have, okay, so aside from chiropractic, if there were one thing that you would encourage a horse owner to add to their regimen for horse care, what would it be?
Well, I'm going to give you the answer that in vet school is the most common answer of all, and it depends.
Yeah. Yeah. Okay.
So, you hate to give that, but it's so true. It depends on what the medical needs are for your horse, because honestly, to me, the most important relationship you're going to have is with your veterinarian, and two's with your farrier that's willing to work with your veterinarian, and vice versa. They should want to work together. So those are your top two most important people. I then often put chiropractic, I would say, as the next highest thing, only because it's a treatment of pain as well as mechanical problems. It's also preventative medicine. It's not just treating. It's, I have a horse that's really athletic and I want him to last for a long, long time. Maybe I use him as a cutting horse. And so if that animal gets chiropractic, you can really delay the onset of some pretty significant arthritis that happens in most of those performance horses. So that's the only reason I put that pretty high on the list. And then if the horse has significant pain that needs to be treated, I'd put acupuncture next.
Okay.
If I had a horse that is really muscular, and your chiropractor should be able to talk with you about this, a massage therapist might be the next best person, because really muscular horses, it can help one to get a massage a little, like barely before chiropractic, because it makes it easier to adjust. But it's also really nice to have massage after chiropractic to prevent those muscles from retightening and relocking up things that chronically seem to become hypomobile. Meaning that if I just release something that's really locked up, I don't want the muscles to retighten and cause it to lock up again. And so working with a massage therapist or working with an owner on, hey, this is the area that you can kind of lightly massage, I think that those work great together. And so after my chiropractic adjustments, I encourage owners to walk the horse for 10 or 15 minutes. I actually will massage some areas, especially in the poll, right after I've adjusted them, to try and encourage elongation of the muscles as opposed to retightening. And then I recommend that the animal has 24 to 48 hours off from heavy work. I like that they get hand walked or that they move around a pasture, but I don't want them to do really heavy stuff, because otherwise they might just retighten an area that finally got loose.
Yeah.
So sort of a cheat answer to your question.
Well, I figured it would, actually, that was much more specific. Thank you.
Mhm.
That's great.
Yeah. So animal osteopathy. This is sort of like letting air out of a tire a bit to go into this, but osteopathic medicine and osteopathic manipulation, some people will talk about spinal manipulation type therapies, but osteopathic medicine is a specific area of medicine. Doctors of osteopathic medicine, so a DO, is a physician, and they take an approach of looking at the whole person. They are looking at nutrition. They're looking at how muscles and joints are moving. They're looking at pressure and resistance. Some people say that if you had a doctor that was, their whole background was body work, and you put it into one profession, that could be it in human. And so, well, I mean, that sounds great for animals, except that it's really not very developed here, unfortunately, in the United States. So is there equine osteopathy in Colorado? No should be the answer, according to essentially Veterinary Practice News. I contacted Narda Robinson, Dr. Narda Robinson. She's the CEO of CuraCore. And so CuraCore is the school that teaches acupuncture, massage, some of the Chinese herbal medicine. They have human sections and they have veterinary sections. And she is a DO and a DVM, and she has a master's, and she does acupuncture. I mean, she has all those degrees, not chiropractic, but point is that she would be the one, right, to know. She's a doctor of osteopath. If someone knows if there's animal osteopath, I feel like she was a great person asking, and there isn't. So there is not a currently recognized guideline for animal osteopathy, nor a recommendation of an approved program for osteopathy for animals. And so there isn't a requirement to hold a degree to say that I'm treating an animal with osteopathy. So I could say that, but there's nothing to back that up. There's no recognized degree of or certification in the US to back that up. Although there's some talk in Texas of certification to try and bring that into the realm of medicine. And there are some veterinarians that say, well, I'm a veterinarian, so I'm covered in all areas of medicine that have to do with animal. Well, if osteopathy is technically a human area of medicine, kind of falls into the realm of chiropractic medicine. So yeah, I'm a doctor of veterinary medicine, and I can, even if I didn't have my chiropractic, I could push on bones if I thought it was medically safe, I can do that. But is depending on the state, you know, you have to have the education behind that to do it in a way that's safe and is medically recognized. We just don't have that for osteopath in the United States. And so the DO is a Canadian group for doctor of osteopathy, says that we should never use the osteopathic term to describe somebody that's not a physician being a human word, that we shouldn't be using that. It's not currently considered appropriate. And so I would just be a little wary of somebody using that term, and then ask them where their education came from that allows them to use that term, and maybe more importantly, what they're going to do to your animal. This is a cool picture. This is a horse, that same horse in that other picture I said is really expressive, and talking about doing a complete exam and looking at it from a medical sense. And I think that just making sure that whoever you get to come is willing to talk with you about your horse, talk with you about the goals you have with your horse, because that's important. You know, if you have an old retired horse, the goal is not to go run around in shows every weekend. The goal is for comfort. Well, there's things that can be done for comfort, and there are things that maybe aren't very comfortable to do, but would be really important if you were trying to get back to work. It's like how much it's palliative care. So I think making sure that the practitioner is listening to not only your wants and needs, but listening to your horse. You know, if they're manhandling your horse and your horse is freaking out, like, oh, it's fine, they should be able to explain what they're doing and why they're doing it. No matter if it's a body worker or a chiropractic person, they should be able to justify what they're doing, and you should be able to see a response in your horse. And yes, there are some areas that when we thrust on a horse, because they're horses, they're going to put their head up, or they're going to back up, or they're going to be a little silly about it. And then they relax and they lick and chew afterward. It's really hard to, you know, a human, they say, take a deep breath and relax, and I'm going to thrust into you. And so they tell you that. Well, telling a horse just, hey, horse, relax, it doesn't always work. So you have to be, your body worker should do the best that they can, and realize that not all adjustments can be done at the first visit while you're still creating a relationship with your animal. And so this is just the thank you. Thank you to you guys, to the Boulder County Horse Association, for all the support you guys have been giving me, and giving me an opportunity to chat with you all. And then Options for Animals College of Animal Chiropractic is the school that I went to. I think they do a really good job of making sure people are not only good at doing the medicine, but understanding why you're doing it, and to look at the whole horse, not just the chiropractic part. Rocky Mountain School of Animal Acupressure Massage was wonderful in answering my questions in terms of what's required in Colorado and resources to use. Dr. Narda Robinson was nice enough to respond to my email asking her about osteopathic medicine, since it's really hard to find a definitive answer, since the answer is there isn't. And then some of the photography. So Jay Stewart did some great photos out in Fraser County. My uncle also has delved into the photography realm and took some great pictures. And then Sonnets, in some of the pictures, she is interested in going to veterinary school and asked if she could tail around with me for a while and learn. And so she's been really, really great to have. And I love mentoring. So it's really made my job easy and fun. And so if I could give you one screenshot to take as a horse person wanting to find a practitioner for maybe your needs, I would say this is the one. And so the National Board of Certification for Animal Acupressure Massage, they list their members. It's kind of a small list. I think Rocky Mountain does a better job of listing practitioners, because they do horses and dogs. And so you can find out what it says what their level of training is and what animals they work on. If you're wanting to find a chiropractic professional, either of the certification programs, but like I said, it's not required in Colorado. Either one of the certification programs gives a listing for their current practitioners. And then CuraCore is great if you're trying to find an acupuncturist, or botanical medicine, rehab. They have a pretty good substantial list. So it doesn't include chiropractic, but does include a lot of complementary therapies for their listing. And then some references. And if you guys have lingering questions, you can contact me. This is my easiest contact email and phone number. You can also, if you're just interested in seeing some good pictures or hearing good information, the occasional video, my Instagram's Medicine in Motion Vet. And there's also some pretty good resources on my website in the frequently asked questions page, but in the education page, there are videos of animals getting adjusted. There's also just a paper from the American Association of Equine Practitioners talking about complementary medicine. So that's a really reputable source to get information about it. But then like I said, you're always welcome to email me. And if I don't know the answer, I will do my best to find someone that can get you an answer. But that's all I have. But thank you all for sitting through it.
Great, yeah. Yeah, that was
I'm
interesting.
curious, Dr. Bacon, are you as busy as you want to be right now? Or are you looking to pick up more specifically chiropractic horse clients?
I am happy to pick up more chiropractic clients, horse or small animal. My Wednesdays seem to be getting pretty regularly booked in the afternoon up in Netherlands. That could obviously change over time, but I'm still taking new clients is the short answer. Saturdays is the other day that I regularly work. And so I would say those are the most open right now. And so I think I have a tiny bit. So I'm booked through this month, but August is not booked up yet. And so it's a great time to sort of get on a program before the summer season's over and determine things that are happening with your horse.
How long is a typical chiro? I mean, again, there's probably no typical, but like a first visit versus a follow-up. How much time are you spending on a single horse?
So on a horse that stands well, on a horse that stands well, and especially if I have an assistant with me working, an initial chiropractic might only take an hour. I would say more typically because I'm talking to owners about what I'm doing, and because there are a couple adjustments that take a second person to support the animal. So I'm teaching whoever the helper is how to safely position their body, and that takes a little more time. Often there's also just a lot more questions. I would say an hour and a half seems to be a little more typical for an initial evaluation. And then follow-ups, unless there's sort of a new problem that we're trying to elucidate, are usually under an hour. I'd say 45 minutes. If the owner wasn't answering questions and I was just going through it in my head, I'd probably do it in 30 minutes.
Gotcha.
Yep.
Because it seems like a really physical job for the practitioner.
Yeah.
You know, I think about this with my farrier too, how they can do so many horses in a day, and there's just got to be a limit.
Yeah. If I'm doing all initial exams, I've done, at the speed that I'm currently going, if it depends on if it's the same owner, because it goes into the same thing of how much am I having to teach, by the second or third animal, if it's all one location, because I do a multi-animal discount if it's all at one location, we get really fast by the third, fourth, fifth animal. But sometimes we have those cases that have significant lameness that just take more discussion. But I would say 8 for initial exams if they're significant medical cases, especially. But I can definitely do a couple more if the horses are really good. If they're follow-ups, I can definitely do more than 8.
Big day.
Yeah.
Thanks. Yeah. And your prices, like pricing stuff, is all on your website, I'm guessing.
Yep. So all my pricing's on my website. My initial evaluations and follow-ups differ a little bit in price because the time's different spent with the animals. And my initial pricing, so it's $140 for an initial exam and $110 for follow-ups. And so we talk about history. I do a conformation evaluation, gait evaluation, musculoskeletal palpation. We certainly discuss any behavioral or rehab type exercises, and I do the motion palpation and adjustments. So that's the initial exam, and that's why it takes so long. And those include basic mileage. So my home base is in Gun Barrel, Colorado. And so if you are within an 11-mile radius, so essentially 22 miles worth of travel, then it's included in that base price. There's no additional mileage charge. If you're outside of that 11-mile radius, it's $2 per additional mile traveled. If there are more than one owner at a location, then I give you I split the mileage if you're having to pay a mileage fee.
Awesome.
And if you decide that you want dogs to come into the barn and you also want your dogs adjusted while you and your horses get adjusted, I'm fine with that too. I really do.
Oh, cool.
I really do work on both. It doesn't have to be at the clinic in Netherland to do small animal adjusting. I like working on all the different patients. So
Cool.
what are
Awesome.
the questions you guys have?
Very good.
Great.
Yeah,
Well,
you were very thorough.
Thanks.
Learned
I
a lot.
appreciate that.
Yeah, it's a lot of stuff, and it's a wonderful field of medicine. And it's just great when all your different practitioners can work together. It's certainly hard when they can't. So they should be able to work together.
Are you meeting some of the local vets and kind of getting your name out among the vets and stuff?
So I would say that's part of why some of my work in Grand County is so busy, since they don't have a person that does chiropractic out there. I'm getting lots of referral from the veterinarians in that area. And then for this area, I mean, working at Netherland Veterinary Clinic, I'm having people come in, and so they're picking up my card. I've reached out to some veterinarians to try and chat with them about cases, and there's been some that I've gotten no response from. So I don't know if that's just because they're busy or they just aren't interested in the chiropractic results for their patients. And then I have another group that's very, very interested in what happens and are referring cases. So.
Well, we'll keep mentioning your name out there for sure.
Yep, and I have you on my docket for I think it's the first week in August. So
Yeah, I'm starting to get crunched on time. For
Yep.
no good reason.
yep, and I can send you an email, and if the timing's a little rough and we need to make a change, we can certainly do that.
Yeah, sounds good. Sounds
Okay.
good.
Thanks.
Well, thank you all.
Thank you.
Mhm.
Yeah,
Thank you.
Yeah.
Have a good night, everybody.
you too.
Bye.
All right.
Bye.
Bye-bye.